Hi, everyone. I'm Karen McNew-McGuire. I'll be your host for this evening. I hope everyone's enjoying their meal and getting to chat with some of your coworkers that we're all so busy at work we don't really get to catch up on much. So I'm excited to be a part of this event. I've had the opportunity to work with so many of you on different projects in my time at Carillion, telling amazing stories, and so it's nice to see so many familiar faces. I also have an opportunity to talk to people in the community, and everyone is always talking about the great work that everyone in this room and beyond is doing when it comes to our patients every day. There's no question that we are all better when we work together, and that's what tonight's event is about. It's about celebrating the fact that you're there for your coworkers, you're there for your family and friends at the same time, and you're doing the best for our patients each and every day. As you know, today is also Veterans Day. I'd like to take a moment to recognize our veterans who have dedicated so much to serving our nation. If you're a veteran and you feel comfortable standing, I would invite you to do so. Thank you to all of our veterans. We are truly grateful for you. Let's take a look at an overview of tonight's program. We have a lot of really exciting awards to give out. First, our President and CEO, Nancy Howell Agee, will announce the President's Award this evening. And next, Dr. Susie Kramer will present our Quality Awards. After that, Dr. Patrice Weiss will announce our Provider Excellence Awards. And then Jeannie Trout will present our Values Awards. So let's get started. The President's Award was established in 2012. It's a special award because it recognizes very specific accomplishments that are truly extraordinary and widely recognized as such. And they're of positive and lasting value. It means you've done something so amazing at Carillion that it is going to live on long past your time with us. I would like to welcome to the stage our President and CEO, Nancy Howell Agee, to present the President's Award.
Good evening. Thank you, Karen. What a treat it is to be here with you all this evening. I want to make a couple comments first and thank members of our boards who are here. A number of our board members are here. If you'd stand and let us recognize you, please. Don't be shy. Thank you so much for being here, especially the chair of our board, James Hartley, and also the new chair of our Carillion Medical Center board, Damon Williams. So thank you all for being here. You know, the recipients of this President's Award join a very distinguished group of people, a group of our employees who've gotten this award previously, and a number of them are here tonight. So I'd like any of you who received the President's Award previously, if you would please stand and let us recognize you. Thank you, and thank you all for being here and for everything that you do for our patients, our coworkers, our colleagues, and this community that we're so proud to serve. Well, once in a while, you get to make awards like this. And I don't know what I was thinking when we started this award, because it's too daggone hard to choose one person. I wish I could give everyone an award, because each and every one of our nearly 14,000 employees with curiosity, courage, compassion, care, and commitment, humbly and collaboratively fulfill our mission. It happens all the time, and there were so many submissions for the President's Award. But people are often sort of not awarded and maybe are unsung heroes. So I brought this email that I got the other day, and I thought I would read it to you. It says, having been at CRMH for nearly my entire nursing career, almost 37 years, I have seen the kind and generous hearts of many, many Carilion employees. Going above and beyond is, for many of us, just something that we do on a routine basis. That is exactly what Bobby Stone did for a patient and his family this weekend. And he'll hate receiving this praise. Tough luck for him, because I'm going to tell his story. Our no-news patient was unable to leave the hospital to be able to walk his daughter down the aisle at her out-of-state wedding on Saturday, this past Saturday. We all hoped he would be able to attend, but early last week it became apparent that he wouldn't be there. I frantically called Annette Blackwell to ask for advice. Was there any possible way for us to stream the wedding to his hospital room so that he could watch? She immediately contacted Bobby Stone for advice. Bobby called me. He knew exactly what to do, although it was a lot of work. To cut to the chase, after hours of working through the details, including a test run on Friday afternoon, the wedding went off without a hitch, and so did the viewing party in the patient's room, complete with mock champagne and a cake brought in by the nursing staff. We do stuff like that all the time. It's amazing, and I thank you all so much for what you do every day. So this year, we're going to recognize not one, but two people for the President's Award. The first recipient is Linda Franklin. Linda, would you join me here? Let me tell you a little bit about Linda. Linda's a certified orthopedic nurse, recently retired after more than 45 years of service. She served as the ambulatory joint care coordinator, working closely with Dr. Joe Moscow, who's here at her table, our chair of orthopedics. Linda led the Joint Academy education class for several decades. That's amazing. She recognized the importance of educating people about what to expect before, during, and after surgery. In fact, I've known Linda for quite a long time, and she was a pioneer in patient-centered education and discharge planning. If there's one word that describes Linda, her daughter's here, and I bet she'll agree, it's spirited. She is filled with energy, enthusiasm, and determination. If you've ever met Linda, you know she's never met a stranger. She put herself in each patient's shoes and treated them like they were her family. Linda, you've retired, but you're always going to be a part of our lives. And in our heart of hearts, we know you'll be there whenever we need you. So I am so honored. You're going to make me teary. So honored to present you the President's Award.
Okay, so how do you say thank you? I know so many of you out here who've been part of this journey for me. And I would like to thank each and every one of you for believing in me, Dr. Moscow for his support, and my family. My daughter will tell you she's put up with a lot of nights when I was not at home. But the main thing is the patients that I've grown to love. I hated leaving my job because of them. But you know, when you're almost 70, it's time to let the young people do it. So thank you all so much.
There's an awful lot of 70-year-olds who'd like to look like you, Linda. You could have fooled us. The second recipient of the President's Award has an interesting connection to orthopedics, and that's Steve Blanks. Steve, would you join me on stage, please? Steve recently retired after 15 years of service on our boards. He served on the CMC board for 15 years, including 2 years as chair, and on the Carilion Clinic Board of Directors for 7 years. He was a member, I think, of every single board committee. He chaired our CAPS committee for both boards, and he chaired the Finance Committee for CMC and served on the Finance Committee of Carilion Clinic. He retired from SunTrust Bank as an executive vice president. Throughout his career, he was an advocate for our communities. He served on boards with for several other organizations as well, like Blue Ridge Public Television, the Foundation of Roanoke Valley, and Wildlife Foundation of Virginia. Steve helped move Carilion forward through his leadership. He was perhaps our biggest cheerleader, even when he sometimes saw the soft white underbelly of our organization. We were lucky to have been able to collaborate with him these past 15 years. Steve, we will miss you, but we know you'll always be in our hearts and part of our Carilion family. Congratulations.
Nancy, thank you very much, and it's really nice to hear sometimes what you do, but it's not that important, and it wasn't that hard for me. What was easy was following the people who are sitting in this room, whether it's the line, the nurse, the doctors, the department heads. You made anything that I did or participated in very easy. And so I just want to thank you for everything that you do every day. Very forward-thinking, very sacrificing in the things that you do every day. And I tell you, the community loves you for it, the patients love you for it, and I love you for it too. Thank you.
Good evening again. It's good. That's really good. All right. I'll just move right along, okay? I get the point. All right, everybody watching their watch there? It's like 2 seconds to say good evening back, but that's okay. Anyway, so next up are the quality awards. And I think, as all of you know, these awards recognize process improvement projects across Carilion. And the teams here tonight have collaborated extensively and learned from each other, finding new ways to be better together. Our quality awards tonight will be presented by Dr. Susie Kramer. And I'll tell you, if you haven't had the chance to work with her yet, I hope that you will soon. But here's a little tidbit, helpful fact. If you try to email her, though, she's under Mary, not Susie. I learned that. Not right away, but after several emails. Why isn't she answering me? Why does it keep, anyway. So let me tell you a little bit about Dr. Kramer. So Susie joined Carilion earlier this year in the Department of Internal Medicine, and she had previously worked at East Carolina University, where she there held a number of leadership positions. She worked extensively in population health, pay for performance, and accountable care organizational work. She's been serving as Carilion's interim Chief Quality Officer since June. And as part of this role, she provided oversight for the Quality Awards application and the judging process tonight. So please join me in welcoming Dr. Susie Kramer to the stage to present tonight's Quality Awards.
Well, good evening, and thank you, Patrice. I appreciate the introduction, and I appreciate being here this evening. I haven't even been here a year yet, and my goodness, it's almost the one-year anniversary, and I'm just so grateful to be here at Carilion and to have the opportunity to share with the Quality Awards this evening is a great thrill and honor. Thank you very much. So our Quality Awards honor significant accomplishments that are helping to improve patient care here at Carilion Clinic. In each category, we will announce all of the finalists and ask them to stand. After we announce the finalists, we will announce the winner and ask the team to come to the stage. The first category is the Pioneer Award, which recognizes projects with a very focused scope. The first finalist is a pharmacy residency project that focused on heparin concentrations for patients with left ventricular assist devices. Team members, please stand. The team found that LVAD patients who received a lower concentration of heparin saw positive results. The lower concentrations helped regulate bleeding times and resulted in trends toward fewer major bleeding events. This research may help improve outcomes for our most critically ill patients, as well as patients in other health systems. Thank you. Nice job. The next finalist is the Meds to Beds project. Would the Meds to Beds team please stand? Thank you. When patients understand their medications and take them appropriately, they have better outcomes and are less likely to be readmitted. By delivering medications to patients at the bedside, we can help them with this understanding. The Meds to Bed team worked to increase the number of deliveries to patients on 7 West by making changes within Epic and improving coordination between pharmacies. The average number of Meds to Beds patients on the unit improved from 23 in 2018 to 30 per month in 2019. That's a lot of patients impacted by the Meds to Beds. Thank you. Wonderful work. And now, this year's winner of the Pioneer Quality Award is the Meds to Beds team. Congratulations. Please come to the stage. Next is the Enterprise Award. This award recognizes projects with a larger scope across the health system. The first finalist in this category is the Admission Discharge Nurse project from Roanoke Memorial Hospital. Would this group please stand? Great. After 5 units began using the admission discharge nurses, they saw significant improvements related to length of stay and discharges before noon. Patient satisfaction scores improved as well, and unit nurses said admission discharge nurses had a positive impact. Thank you. Great work. The next finalist is a team who worked to improve sepsis outcomes for patients entering CMC through the emergency department. If the sepsis team could please stand and be recognized. This team made a number of process improvements, including updating the sepsis screening tool, establishing separate care paths for sepsis and septic shock, creating a new septic shock alert, and making it easier for nurses to call a sepsis alert in the emergency department. After these changes were made, there was evidence of significant improvements to sepsis mortality rate for these patients. Excellent work. Thank you. So this year's winner of the Enterprise Quality Award is the sepsis team. Congratulations. If you'd please come to the podium. Tell if it's like the Oscars or the Grammys, but there's a lot of similarities when you're on this side of the audience. So next is the Community Distinction Award. Oh, you're fine, take your time. So as I was saying, next is the Community Distinction Award. And this award was introduced last year to recognize an exceptional project from one of our community hospitals. The first finalist in this category is a team of environmental services at New River Valley who developed a training manual for their processes. If this team could please stand. The EVS staff did not have a standardized training, which resulted in low inspection scores and may have contributed to some high turnaround times. This team created a standard training manual and saw inspection scores improve from 40 to 85%. Thank you. Wonderful work. Great job. The next finalist is a team from Giles with a project entitled Improving Health Outcomes Through Pharmacist Encounters. Will the Giles team stand? about a third of patients admitted to the hospital at Giles have comorbid diabetes. The team focused on improving outcomes through medication reconciliation. They increased pharmacist rounding and followed up with patients more frequently. As a result, they improved patient experience scores and readmission rates for these patients. Thank you. Wonderful work. And the third finalist in the community distinction category is another project from Environmental Services at New River Valley that focused on reducing bed tracking turn time. Team, let's stand, okay? So this enthusiastic team, in 2017, it took 60 minutes on average to clean a room, and the Environmental Services team made changes to improve turnaround time, including standard training, appropriate staffing, monitoring and sharing performance with staff, and promoting teamwork within the department. They saw a turnaround time drop to 50 minutes in 2018 and 47 minutes in 2019, exceeding the national benchmark. Thank you. That is wonderful work. And now, the winner of this year's Community Distinction Award is Improving Health Outcomes Through Pharmacist Encounters. Congratulations. If you'd please come to the stage and accept your award. This year, we introduced a new quality award category, and the Excellence in Advancing Care Delivery Award recognizes projects that don't quite fall into the traditional process improvement framework. The finalist is the Baby Bridge Project from the Pediatric Therapy. Pediatric Therapy, can you? The Baby Bridge Clinic provides a transition from hospital discharge to ongoing services for infants who need help and early therapy services at this stage. Receiving therapy earlier can help with long-term outcomes. Since the clinic opened in April 2018, they have been able to provide services to infants several months earlier than we had in the past. This is a dramatic improvement. Thank you. Great job. The second finalist is a project from dermatology that focused on postoperative pain after Mohs surgery. Will the Mohs team please stand? This study found that patients who were prescribed opioids after Mohs surgery were no more satisfied with their pain management than those who were not prescribed opioids. They reduced the percentage of patients who received prescribed opioids after Mohs surgery from 15% to 5%. Of those 5%, select patients only received 3 pills instead of 20. Thank you for doing the right thing. Great work. The winner of the Excellence in Advancing Care Delivery Award goes to the postoperative pain after Mohs surgery. Congratulations. next quality award is the Hold the Gains Award. And this award is given to the team that maintained improvement efforts on a project they had previously submitted. The first finalist for the Hold the Gains Award is from Pediatrics and Roanoke City Student Health, focusing on emergency albuterol administration. Will this team please stand? In 2014 and 15, an average of 6 students per year were taken to the hospital by EMS for asthma. This team changed the guideline to allow school nurses to administer albuterol even if a diagnosis of asthma had not been established. Total EMS transports were reduced 32% over 3 years. Wonderful work for our asthma patients. Great job. Thank you. And the next finalist is a project from our NICU team entitled Journey to Zero CLABSIs. Will the pediatric NICU CLABSI team please stand? So CLABSIs are known to increase morbidity, mortality, and healthcare costs, especially for infants in the NICU. When our NICU saw a jump in CLABSIs from 2014 and 15, they implemented best practices related to sterilization techniques and a dedicated insertion line team. So far, they have had 0 CLABSIs in 2 years. They have also reduced their central line days by 25% over 5 years. Cost savings are estimated to be approximately $1.4 million since the work began in 2013. Wonderful work, thank you. And this year, the winner of the Hold the Gains Award is Journey to Zero, CLABSIs in the NICU. And the last quality award this evening is our MVP award, which is the award given to the best overall project. This year's winner is the project, Special Delivery, Handle with Care, a New Approach to Treating NAS. The neonatal abstinence syndrome is the name given to withdrawal symptoms in infants who are exposed to drugs prenatally. In 2018, we opened a transitional care nursery at Roanoke Memorial to treat these babies. There have been some important, significant improvements. Average length of treatment decreased from 90 days to 8.6 days. Average cost of care was reduced from over $30,000 to $9,000, and average percentage of NICU babies requiring pharmacological intervention decreased from 100% to 28%. Thank you for your dedication. Your team members have done remarkable work. Will you please come to the stage and accept your award? So I want to congratulate all of the teams here tonight. I also want to say thank you. Thank you for speaking up. Thank you for sharing your knowledge from the front line. Thank you for collaborating and working to improve outcomes and to keep our patients safe. It's your work that makes us better together. Please, let's give all of our teams a round of applause.
Our next set of awards are our Provider Excellence Awards. Recipients were nominated by their colleagues for a number of things, for their clinical skills, for their leadership, and their dedication to their patients and their colleagues, and not to mention their communities at the same time. These are clinicians who we would choose to care for us and our family members. And now Dr. Patrice Weiss joins us on stage to present the Provider Excellence Awards.
I don't dance. I'm staying behind the podium. All right, thank you, Karen. And again, this is just the best night in Carillion. Is that not true? So we've heard a lot tonight about teamwork and the importance of teamwork. And I'd like to share a few words with you about teamwork from someone who has really inspired me. No, it's not Barry Manilow this time, okay? It's Coach Pat Summitt. As many of you know, Pat Summitt, yeah, very inspirational. Pat Summitt was the head coach of the Lady Vols basketball team and unfortunately had early onset dementia of the Alzheimer's type. And this is a quote from Pat. And Pat said, "Teamwork is a form of trust. It's what happens when you surrender the idea that you can go it alone and realize that you won't achieve your individual goals without the support of your colleagues." And to paraphrase that, I would say, there's no I in team. The recipients of the Provider Excellence Awards know that. Through teamwork, they can achieve more than they could have done on their own. So our first award tonight is the award for residents or fellows. And I'd like to ask Dr. Don Keyes, the Vice Chair of Pediatrics, and also Carillion Clinic's designated institutional officer for graduate medical education to join me. And he has. Thank you, Don. We're getting good at this. We've done this a couple times together. Yes, yes. So this year's recipient of this award is Dr. Lindsay Byerly. Lindsay, yeah. Lindsay is a second-year resident in internal medicine. And sadly, after losing her father to colon cancer, Dr. Byerly worked to increase awareness of the need for screening. She organized a number of fundraising efforts, which brought in more than $2,000 for Carillion Foundation. And that money will help pay for screening colonoscopies for patients who can't afford them. She also organized a colon crawl walk at Riverside. She was featured in local news articles and gave CME talks to several departments. And Lindsay, I'm sure that your father is just absolutely beaming with pride right now. So congratulations, Lindsay, and please join us on the stage to receive this award. Our next award is the Award for Advanced Clinical Practitioners. At this point, I'd like to ask Lori Seville and Luke Swatsena are co-chairs of the ACP Advisory Council to join me on stage to help hand out this award. And this year's recipient is Chris Trout, a nurse practitioner with family and community medicine. Chris recently retired after 43 years with Carilion, and she held multiple certifications, including as a sexual assault nurse examiner, a nurse practitioner, and an emergency room nurse. She served as a mentor to her peers and her colleagues, and as an advocate for her patients. Through her forensic work, she supported many patients who felt they didn't have a voice. The person who nominated her said, "She has an unmatched art of listening and understanding each patient without any judgment or preconceived thoughts." Now, Chris is so retired that she wasn't able to be with us tonight. Linda, thanks for coming. No, but in accepting on her behalf is Shelley Butler. And Shelley, if you could please join us on the stage to receive this award for Chris. And I just learned something, that the person receiving the award for her tonight was also her nominee, so way to go. Thank you for that. So our final presentation tonight is the Provider Excellence Award, and that is an award for physicians. And this year's recipient is Dr. Christina Dunbar-Matos. Christina is a cardiologist. Now, if you're sitting all the way to the back, you might as well just start making your way, I guess. But Christine is a cardiologist who works in our heart failure clinic. And while relatively new to Carilion, she immediately exemplified our values by helping to develop the heart failure program for 7 West. She played a key role in developing our outpatient IV Lasix protocol, implementing REDS vest, and redesigning patient education for heart failure. One of the people who nominated her for this award praised her willingness to collaborate with other departments to improve heart failure treatment and care transitions through teamwork. So congratulations, Christina, and please join me on the podium. So congratulations to each of our Provider Excellence Awards, and please join me one more time in giving them a round of applause.
The Values Awards are given to employees who exemplify our values, going above and beyond what's expected in their work and their job roles. And we certainly have heard a lot of stories of that this evening. We give an award for each of our values: commitment, curiosity, courage, compassion, and community. I got them all. Jeannie Armentrout is here to present the Values Awards tonight. Jeannie.
Thank you, Karen. Good evening. Ah, you're getting better at that. Anybody having a good time? Yeah. And we're going to have some more fun. I am so honored to be here tonight to present the Values Awards to some incredible people and incredible teams who bring to life the values each day. At Carilion, our culture is our foundation. Our mission and our values guide our behavior, our decisions, and set us apart as a leader in healthcare. Not many organizations have curiosity as a value. In each category, I will announce our honorable mentions and ask them to stand and be recognized. I will then announce the winner and ask that person or team to join me on stage. Our first award tonight is Commitment. We have 2 honorable mentions in this category. First is Dottie Cook. Dottie, please stand. Dottie is a nursing team lead for the coronary care unit at Carilion Roanoke Memorial Hospital. She has been with Carilion for almost 35 years, and she demonstrates her commitment by sharing her expertise with colleagues across the hospital. Fellow nurses, physicians, residents, and environmental services employees, and frankly, all team members benefit from her expertise. Great job, Dottie. Let's give her another round of applause. The second honorable mention is a team of clinical administrators and care techs from Carilion Roanoke Memorial. Please stand. This team helped care for a colleague with a terminal illness who had no family or support structure. They took him to appointments, visited him daily in the hospital, brought him things he needed, and helped with end-of-life decisions. This wasn't part of the job. It was done out of love and kindness for their colleague. You know, we talk sometimes about Carilion being a family, and this team showed just how true that description is. Thank you for your commitment. Let's give them another round of applause. And now, this year's Commitment Award goes to Pamela Holcomb with Pharmacy and Medication Assistance in Roanoke. Pam is a pharmacy tech lead who helps patients who qualify for free or reduced cost medications. She recently began tracking orders for medications that are known to be expensive. That way, she proactively helped patients who need assistance instead of waiting for referrals. Her commitment helps improve outcomes because patients are more likely to take their medications if they can afford them. Congratulations, Pam. The Compassion Award. Before I announce this year's winner, let's recognize our honorable mention in this category, Stephanie Trail. Stephanie, please stand. Stephanie works in the electrophysiology lab at Carilion Roanoke Memorial. She was nominated for her positive spirit and comforting demeanor with patients. The person who nominated her said, "I have never seen Stephanie in a bad mood." She greets every coworker, every patient, and every patient's family member like they are her own. Great job, Stephanie. Our Compassion Award winner this year is Dr. Roberta Eanes, a third-year resident in emergency medicine. Dr. Eanes was helping care for a patient who was taking a turn for the worse and didn't understand his prognosis. She took considerable time to talk to him and help him understand. The patient asked if we could contact his son, who he hadn't spoken to in years. With little information to go on, Dr. Eanes used her knowledge of the military and the Red Cross to track him down. The patient was able to talk on the phone to his son before he passed away several hours later. Dr. Eanes went beyond her job role to make a difference for this man in his final hours of life. This is what compassion is all about. They just keep getting better. Our next award category is community. We have 3 honorable mentions this evening. Gail Vyers. Gail, please stand. Gail has worked for the pharmacy in Tazewell for almost 20 years. She was nominated for her willingness to donate her time, resources, and talents to help anyone who needs it. Her coworkers say she is the first to donate food or money when someone is sick or unable to work. Thank you so much for your generous spirit, Gail. Congratulations. Our second honorable mention is a team from psychiatry in Roanoke for their work developing an office-based opioid treatment program. Please stand. Since 2017, this team implemented a number of successful programs for patients with opioid use disorders. A bridge clinic to help the ED patients until they could receive outpatient services, a program for pregnant women, and increased access to medication-assisted therapy for patients on medical units. These programs have helped patients overcome barriers to care such as transportation, childcare, and lack of phone service. Thank you for what you are doing to help our patients. Congratulations. The third honorable mention is the Urban Farm Team. Would this team please stand? This team took on a challenge that was outlined in the 2015 Roanoke Valley Community Health Assessment to bring local, affordable produce to Southeast Roanoke. They collaborated with their neighbors as well as other nonprofits in the community to develop an urban farm, which offers gardening and fresh foods and educational events. This is an example of how collaboration can help our communities. Great work. And now for our Community Award winner. This is a name you've already heard once tonight during the Provider Excellence Awards. It speaks to the quality of her work that she was chosen as an award recipient by 2 separate groups of judges. Dr. Lindsay Byerly from the Internal Medicine Residency Program. As you heard earlier, Dr. Byerly worked diligently for colon cancer screening. Her work to increase awareness about colon cancer required a great deal of collaboration to reach people in our communities. The person who nominated her said, "I have never come across a resident that has been so committed to improving the lives of the communities we serve." Congratulations, Lindsay. The Courage Award. We have 2 honorable mentions in this category. Christina Gardner with Family and Community Medicine. Please stand. Christina is a physician assistant and developed an orientation program and competency checklist for ACPs at Velocity Care. The program has expanded and now includes quarterly skill-building workshops tailored to meet the needs of urgent care ACPs. Thanks to Christina's curiosity, she is helping new ACPs become stronger providers. Great job, Christina. The second honorable mention is the team from Hospice that worked on a project to address caregiver burnout with the Roanoke Hospice team. Please stand. There they are. The department's engagement survey results showed a need to focus on workload and retention. They collaborated with EAP to develop creative solutions. These include monthly bereavement rituals to address the compassion fatigue that comes from working with hospice patients. It takes courage to begin taking care of ourselves and our colleagues, and the hospice team did just that. Great job. And now, our Courage Award winner this year is Darrell Dewey. Darrell has worked for Carilion for 32 years and is currently a CTL with inpatient clinical transport at Carilion Roanoke Memorial. Earlier this year, he was driving home during a downpour and stopped to help an elderly woman walking toward Mill Mountain. Darrell waited with her until help arrived. It turned out that the police were looking for her, and they were relieved to know that she had been found. The person who nominated Darrell said, "He is the kind of person who sees people in need and does what he can to help." Great work, Darrell. Please come to the stage. Our final Values Award tonight is Curiosity, which is my personal favorite. We have talked a lot about curiosity this year. It was the theme of our annual report and our brand commercial. Our curiosity shows through in many ways that we constantly search for innovation and improvement. In the curiosity category, we have 2 honorable mentions. The first is Lisa Girani from the Emergency Department at Roanoke Memorial. Lisa, please stand. Lisa has dedicated many hours to research and to educate about ventilator-acquired pneumonia and the ways that early interventions can help our patients. She is passionate about finding ways to decrease morbidity and mortality rates in the emergency room. Great work. The second honorable mention for curiosity goes to David Fox and Craig McCowan, also with the emergency room at Roanoke Memorial. David worked with chaplain services on a program to increase resiliency and morale among the ED staff. Part of the program involved checking in with employees after difficult situations. They saw a significant increase in Press-Ganey scores after focusing on resiliency. David and Craig are now working on more ways to improve morale in the ED. This is just another example of the importance of caring for ourselves and our coworkers. Great job. And now, this year's winner of the Curiosity Award is the ADL Outcome Collaboration Team. This team from the New River Valley Office of Home Care worked to improve patient outcomes on activities of daily living. Our quality scores showed declines in bathing and other activities. When the supervisor and quality staff discussed solutions, they realized that they were missing a huge piece of the puzzle by not including the certified nursing assistants and the occupational therapy assistants in the planning. They expanded the team, developed a pilot program to help patients achieve more independence by working with the occupational therapy staff. Scores on the bathing measure improved and exceeded the national average, and the team is now focusing on additional activities of daily living. One way for us to be curious is to seek input from multiple perspectives and from different job roles, and this team did exactly that. Please come to the stage to accept your award. Congratulations again to all of our Values Award recipients. Each year when I attend this award, I am continually inspired by the ways that we put our values to work. Let's give all the Values Awards winners another round of applause. And now, I'd like to welcome our President and CEO, Nancy Howell Agee, back to the stage.
Thank you, Jeannie. I'm feeling like Susie was right. This is sort of like the Academy Awards, and as I look around, I think nearly everyone in this room has stood up at least once. But there must be somebody who hasn't stood up. So why don't those of you who haven't stood up yet stand up and let us give you all a round of applause. We have some humble people here. You know, if I can stand up, or all of us can stand up here and have our pictures like, I don't know, 10 times, and you can see every wrinkle and gray hair, and at least you all can stand up. What a great night. Thank you all so much for being here, and thank you for your incredible service. It is really humbling when we hear about all the work that happens all the time. And we just heard of the cream of the crop, right? So even though there were finalists, there were dozens of teams and people who are also every day doing tremendous work. So thanks to each of you. Thank you for being here. Thanks again to our board members who are here. It's a big commitment for you all to come and support us in the way that you do, and we greatly appreciate it. I want to also thank those who made this event happen. I think this is the prettiest time I've ever been in this ballroom. It's just beautiful. Everything has been done perfectly, and it doesn't happen by happenstance. It takes a lot of work behind the scenes. So I want to thank all of those who made this evening happen, and let us give you a round of applause. Likewise, I want to thank our very own celebrity, Karen. Where'd Karen go? Karen, congratulations. Thank you so much. Karen works hard all throughout the year, and all you have to do is go to YouTube and pick up Carillion, and you'll see dozens of things that she's doing. I have to tell you, I got a text the other day from the governor who said, I don't know what you're doing out there, but your social media rocks. What a great system you have. So that's pretty cool, huh? Thank you to each of our presenters, to everyone who nominated someone, and I give you this as a challenge. You know others who ought to be here next year. So, pay it forward. Nominate a team or an individual next year. Thank you to our judges. I can't imagine how hard that is. Thank you, Susie, for your leadership there. We sheep dipped you right as you came. Thank you to the process improvement team, to marketing and communications, really to everyone who made this ceremony come together. Well, we've heard a lot of success stories tonight, and each of them involved our values. Interestingly, each of them also involved getting better together or collaboration. Collaboration among colleagues, between and among departments, and with our community partners. The truth is, collaboration is sort of synonymous of who we are, of our name, and we've been collaborating for years. It's nothing new to us. So if collaboration isn't something new, why the heck have you heard it about 100 times tonight? And why am I talking about it so much? Well, I am so excited to tell you this, that maybe I won't do it alone. In fact, I've asked for a little backup from a team that knows all about collaboration. So like the marching band from Glenver High School, we are better when we work together to achieve shared goals for the communities that we serve. So tonight, I'm presenting to you a new value: collaboration. We've evolved as a system, and collaboration reflects who we are today. It's vital to our progress as we move forward and accomplish great things together. Over the next few months, we'll introduce new ways to recognize each other for collaborating and to recommit to all of our values. You guys are the first to hear it tonight, and effective in the morning, I'll announce a new value of collaboration to all our employees. Thanks again to each one of you for being part of this memorable evening. I hope you've had a great time. My hands are kind of worn out from clapping. I don't know about you. Thank you to the Glenver High School Marching Band for collaborating with us tonight. And band, if you will help me say adieu, we will close our evening. That's fun to do. Good night, everyone. Drive safely home.